And welcome to today's webinar, Quick Wins to Optimize HIPAA Compliance Management using ServiceNow IRM. This is certainly top of mind for all of our healthcare customers. We appreciate you spending time with us today as we talk through ways to improve your HIPAA compliance experience. A couple of quick housekeeping notes before we get started. All lines have been placed on mute. We will be monitoring the Zoom Q&A for questions. We do ask that you post your questions in the Q&A as opposed to the chat, as it will allow us to ensure that all of the questions have been answered. This webinar is being recorded and will be shared along with today's slide deck. Following today's event, you will be receiving a very short survey. If you don't mind, we would appreciate you taking a couple of moments to complete, as this feedback is helpful to ensure that we are always providing valuable content. By way of introductions, my name is Christy Drzezinski. Everyone calls me Drew. I am a risk solution sales executive covering ServiceNow's healthcare accounts. I've been with ServiceNow for just under 9 years, and I'm based out of New York City. I am joined by Barb and Hunter from our elite partner, Agile, a Wipro company. Barb, would you mind introducing yourself?
Sure. Thanks for having me here today. I'm Barb Johnson. I'm a managing director at Wipro, an Agile company, and I lead our risk and compliance transformation practice with a focus on ServiceNow. I have a background in healthcare, and that's why I'm very excited to be here today because healthcare is near and dear to my heart. Over to you, Hunter.
Great. Thank you, Barb. Good afternoon, everybody. My name is Hunter Freeman. I'm a senior manager with the Wipro Agile team, working with Barb in our risk and compliance transformation practice. And I'm specifically our technical go-to-market leader, helping to educate our customers on how they can best leverage ServiceNow and other solutions to enable their program objectives. And prior to coming over to the sales side, I previously implemented these solutions for about 6 years. So, pleasure to speak with everyone today. Thanks, Drew.
All right. Thank you, Hunter. Thank you, Barb. From an agenda perspective, Barb will begin by walking us through a very brief overview of HIPAA, as well as ServiceNow's integrated risk management solution and Agile's ARC content, and how all of these can be used together to drive efficiencies as it relates to your HIPAA compliance program. Barb will also talk through a case study of a customer journey that was delivered by Agile. From there, we will turn it over to Hunter, who will provide a live demonstration. And last but certainly not least, we will leave a few minutes at the end for Q&A and wrap up. Before we get started, we have a quick poll question that we would love to gather some information from the audience. What are some of the challenges that you face with your HIPAA security rule analysis today?
And Drew, I'm seeing some answers come in. I know teams I've worked with in the past have definitely faced challenges with single source of truth, both for the safeguards as well as lack of CMDB or just too many things to try and assess. So seeing some good results come in here. All right.
Almost have a tie.
Yeah.
For number one.
It's like we are ready.
Okay, so it looks like manual processes and lack of single source of truth for safeguards. We're definitely in the lead. So appreciate everyone's participation there. Barb, if you're ready, I'll turn it over to you to talk through an overview of HIPAA.
Absolutely. So I know if you're on this call, you likely understand or know a bit about HIPAA, so I don't need to go into too much detail, and I won't pontificate up here to y'all today, but just wanted to provide a brief overview and focus on the key areas for why we feel that it can be complicated when figuring out what needs to be included in scope and how teams can address their assessments as it relates to the security and privacy rule, particularly the security rule. So HIPAA was established in '96 and is focused really on EPHI. I know that teams really want to focus on PHI overall, and it's important to do so, but the teams most likely aligned under the CISO organization are really going to be focusing in on that electronic protected health information. This applies to health plans, healthcare clearinghouses, healthcare providers, and then covered entities and business associates. There can be some really complicated gray area in what those entities look like, depending on joint ventures and all different types of legal arrangements. So getting your legal team and compliance team involved in that type of decision-making and where it applies is really important, and we won't get into that today. But the types of controls and how best to approach the assessment is where we want to focus. So the types of controls that are included: administrative, physical, technical, whether that's termination of users or administrative controls, and looking at passwords. All of that is included within 45 CFR 164 in those sections listed on the screen. The good news in the HIPAA security rule is that there is a section around a flexibility of approach. And so what this allows health plans and providers and clearinghouses to do is you can take a approach that makes sense to you and your organization based on your size, complexity, what EMR you have, as well as what resources you have to conduct assessments. As long as you document that approach and it makes sense. If you just document, we're not going to do an assessment, OCR is probably not going to like that. But if you document a sound logic to why you're scoping only certain areas of your healthcare system, I think that's a valid approach. Although please run that by your compliance and legal team. But that flexibility approach is there for a reason. And then the last piece here, required versus addressable. There are two different types of safeguards noted. And again, this allows the team to have a different view as they're walking through those safeguards. So required, not a lot of wiggle room, but addressable gives you the option to say that safeguard or control isn't right for our environment. And so you need to document why, but you could have a compensating control or approach it with another lens to meet the need. But what that means and how that creates a challenge is that it is not a clear-cut regulatory requirement as some of the other regulatory requirements or frameworks that you see out in industry are. So you're not going to see anywhere in HIPAA security rule a certain number of password characters or length of time before passwords need to be reset. That's just not the level of detail that this gets into. So how should teams approach that? So what we recommend, and oh, I'm sorry, before we get into what we recommend, we have another polling question. So want to know how teams are managing their risk assessments today. Like we talked about, there's lots of complexity. Want to understand how you and your teams are handling that. Teresa, if we can kick that off.
Give us 1 second here. I think
Sure.
it looks like it's been launched already.
Okay.
So maybe we need to go ahead and with the presentation and I
Okay.
will get this
We can
fixed
come
and we
back
can
to
do it a
it.
little bit later.
Okay, all right, sounds good. Well, there are a variety of ways to conduct your risk assessment, but what we're going to talk through today is how you can use IRM in ServiceNow and advanced risk to do so. So when we look at the landscape in ServiceNow, particularly in risk and security operations, thinking through what rolls up in a CISO organization, we think about starting with governance and oversight. What are the regulatory requirements that the team is going to be focused on and needs to report up to? And one of those things in healthcare being HIPAA. And then integrated risk management being a good tool and module to answer that need and requirement. So then if we drill down a layer deeper, we can see that within the governance and oversight, we're able to pull in specific laws and regulations, as well as maybe our own healthcare provider policies and standards. We're able to have a risk register that the teams can report out to the executives and C-suite and be able to make strategy decisions from. And then moving into the integrated risk management space, we're able to conduct surveys and attestations, do control and control testing, as well as reporting out findings and remediations. This is all very important when thinking about the HIPAA risk assessment process, because you can keep it all within one contiguous module and report out from there with an audit mindset. So all of that documentation is going to be retained for the length of time you need it to be. I know certain auditors, particularly in the government space, when we're thinking about maybe Medicare, Medicaid, have up to 7 years to come back and look at the HIPAA risk assessments. And then as we think about business continuity management, vulnerability response, and some of these other modules, there may be data within there that is helpful when answering the surveys and attestations for a HIPAA risk assessment. Moving on to how do we go about implementing it? So first you want to start by planning for success. So what coverage do you need to have? What should our program be doing? Are we only focused on HIPAA, or do we need to cover off on PCI maybe because we're accepting credit cards within the gift shop or cafeteria? And what is that population? Are we looking at just the hospitals? Are we also looking at the ambulatory locations? And then moving into design, how are we going to work through all of that and deliver the coverage needed to meet the ask? Next, we think about capacity. Do we have the resources it's going to take to deliver all of that? Do we need more staff on the team, or do we need more automation included in the workflow? And IRM is a great tool to add that workflow automation, so you maybe don't need to add more people to the team, particularly if your answer to that last poll question would have been that you're performing these assessments manually with Excel or Word documents or interviews, things like that. And then the last piece here is the service model. So when we think about the structure on the right-hand side of the screen, what governance should we have over the program? What roles and responsibilities is everybody playing in this? So certainly the information security team can't do this alone, need either legal, compliance, privacy to weigh in, depending on the structure of your organization. What are the documented processes and procedures? And how can we make that cyclical? What reporting should be in place so everybody knows when we're done, what came out of the assessment, and then the technology to support this to make it easier. Training and awareness to make sure the team is able to be as efficient as they can be. And then what assurances do we have to make sure we're performing as effectively and efficient as we can be? So then moving on, it's easy to get overwhelmed by how much should or could be done. So we like to think of this as a phased approach with integrated risk management and the HIPAA risk assessment. You only have a limited number of resources, and each team is going to have a detailed requirement for how precise they need to be. So your team is going to drive what level of confidence you want to achieve on this 5-pass model. That decision shouldn't be made in a silo, in my opinion. So you want to involve, again, your legal, compliance, or privacy team, depending on your organizational structure. And from there, you can say, we want a moderate level of confidence, so we should work through not just the risk register and the risk assessments, but we should make sure we're doing a touch of control, documentation, and documenting policy exceptions, things like that. All right. From there, you're maybe thinking, okay, I understand how we're going to do IRM, but how are we going to understand everything that there is to know within HIPAA, being that it's so subjective, or it's not subjective, I should say. So we have what we call the ARC content, and that provides different regulatory compliance and frameworks that we have taken and pulled together in a harmonized fashion. And it's available for 20 industries, but today, obviously, we're going to focus on healthcare life sciences. And it leverages a 3-pronged compliance approach. So we have the source content that we're monitoring and updating. So if CIS or NIST, CSF comes out with a new version, that's going to get updated on a quarterly basis. And that comes with a source change notification. And then there will be compliance reporting. And what this looks like in practice is that there are 850 authority documents parsed out into 70,000 plus citations. And those are verbatim line item citations. So we haven't taken an interpretation of HIPAA, which I think is really important, because when you start to interpret what HIPAA means, that's maybe something best suited for a legal or compliance team. And so those citations are verbatim, but they have been mapped to control objectives and risk statements. And so those control objectives and risk statements can be tested by your team or conduct risk assessments against those. And that's where you can gain the additional efficiencies. So if we use this picture as an example, your team may have to work to meet HIPAA, but may also have to comply with PCI requirements. And so if you have password standards you need to look at under HIPAA, as well as under PCI, PCI is going to dictate that you have X number of characters within that password. HIPAA is not, but here, as we harmonize those authority docs into the citations and then one harmonized risk statement and control objective, you can do the test once and apply many approach for your EMRs, etc. Now, that integrated password requirement is maybe not as applicable for a data center or an MER if we're thinking PCI, but PCI may have requirements to keep those locations secure depending on how you've structured your PCI environment. So this is a way to pull in the content, have it available and readily available to your teams in that citation format, and then harmonize it and use it in that assess once, apply many within your ServiceNow IRM environment. And so rolling into the case study, what we were able to do for a customer of ours is implement ServiceNow IRM advanced risk within a 12-week implementation cycle, starting with the risk register and moving into entity types and entities. We helped them develop assessments for key assets that contained EPHI, their primary EMR, their secondary EMR that they used for the ambulatory locations, as well as a data center assessment and a secondary physical site assessment. And then they were able to perform risk analysis based on those assessments we created and configured in their environment. And those risk assessments were performed with a level of automation in their workflow to allow for automated issues to be generated when the risk tolerance was breached. That helped the team spend less time in the weeds and more time focused on the issues that were above their risk appetite. And then lastly, that overall implementation helped them see the bigger picture with reporting, because they had a dashboard with a heat map that they were able to walk through with their executive level team and present to the board ultimately. And then I don't know if all of you refer to the reporting as being needed for an assessment binder, but I've seen at several healthcare locations and providers that because it used to be a physical binder that you would stick everything into when it used to be called meaningful use, that term has carried over. So the reporting can be generated per entity within ServiceNow IRM, and those PDFs can be saved in what is now a virtual assessment binder for promoting interoperability or whatever you need that for to continue meeting your regulatory requirements. There were several very key benefits for this team. They were able to decrease the time needed to complete the assessments. They had an audit log of all assessment activities ready and available in case any regulatory body came to audit their activities. They were able to complete more, remote assessments, which in the post-COVID world is really key. And they were able to conduct more assessments. So even though they followed that flexibility of approach methodology, they were able to increase the number of ambulatory locations they were assessing and see more in the field to understand where some key risks were for them that needed to be corrected. And they were also able to increase their ability to track risks and issues with notifications to help their subject matter experts respond to those risks and issues in a more timely fashion. So overall, I think the team was very happy with what they had with the implementation, and they were able to optimize without adding an additional team member or members to the bench. So with that, I will pass it over to Hunter for the demo.
So while you're getting the demo ready, Hunter, would you all like to launch the next poll and see what we find out from customers here about their assessments today?
Ooh, perfect timing, Teresa.
All right, let's see what they have to say.
Perfect. And I'll maybe just give a minute on this, Teresa, and we will get into the system here.
All right, I see a few things coming out.
Yeah.
Manual, ServiceNow, a few other solutions. All right, I think they're slowing down. Let's go ahead and end the poll and we can share the results. Manual is a high. Again, lots of manual processes.
I've
All right.
definitely been in those shoes and understand the challenges associated.
All right, well, I'll turn it over to Hunter now.
Thanks, Teresa.
Great. Thank you, Teresa. So what I wanted to demonstrate today is really just take folks through an example of what operating your HIPAA risk assessment process can look like in ServiceNow and how we apply some of those lessons learned and good practices that Barb was mentioning during the presentation and really bring those to life. So first, where we like to start is just with an example of what the risk management workspace in ServiceNow can look like. And so I'm logged in right now as a risk manager for my healthcare organization. And right at the top here, I'm able to select my HIPAA risk assessment. So the methodology I'm employing to perform my annual risk assessment. And by choosing this, I can get at a glance summary statistics across my environment, specifically for my HIPAA risk profile in this case. So I can see that from past assessments I've completed, maybe last year's results, I've got a breakdown of my risks in terms of low through very high, and we can even start to get into heat map reporting. We'll take a deeper dive into what some of this reporting can look like. But there's a lot of value for me as a risk manager in just having all of this information at my fingertips on my home page. And it's not just limited to reporting, but also giving me a quick view. What activities, what tasks, what work do I need to get done? Maybe those are risk assessments I need to complete as part of this year's campaign, or what's pending in my group's queue. And we can also start to get into summary information. So what are the highest risks in our environment? Where do we have perhaps open issues because we breached that risk tolerance and we need to go and do something about that? Or if we have overdue tasks, hopefully not 1,400 overdue tasks, but items that we need folks' attention on. So really just surfacing all of this information for me as a user so I can effectively manage my program. But what I wanted to show the team next is just a quick example of that ARC content that Barb was mentioning, how we can tie this out to various different sources in our environment, and then use this as the basis for a risk register and go forward with a risk assessment campaign within ServiceNow. So I'm looking at what's called a control objective, and this is effectively a control within my compliance framework. In this case, or control I require around management approval of privilege assignment. And looking at this control objective, again, I'm going to get summary information about how does this control look across our environment. I have 6 controls derived from this. So overall, I know that I'm 80% compliant against this objective. And it turns out that that 20% difference perhaps is because I have one failed control test related to my Acme Care EMR that we'll be using as our example today. But really where the power of this comes in is when we look at these citations. And so I've filtered my list here slightly, but this is the key concept where ServiceNow enables us to link our controls, our compliance frameworks against all of our relevant regulatory mandates. So not just HIPAA, but that broader world of sources that we may need to address. And so I can see I do have 2 subsections from HIPAA mapped here, where we're talking about the need to have sign off on our privileges before they are provisioned. But I can also get accessory information. So maybe if I want to consult NIST 853 as a additional source on what is actually expected, how might I go about implementing this control, we can link all of that information here in one place and really start to use that as the basis of our program. But where it starts to get even more exciting is our ability to do truly integrated risk and compliance. So while of course I need to implement controls to comply with HIPAA, we're here today to talk about our risk assessment. And so I can link the controls in my framework against their corresponding risk statements, which would comprise what I might think of as my risk register. And so if we just drill into this linked risk statement, we're again going to get summary information. I've assessed this risk in various places in my environment as part of my HIPAA risk assessment methodology. I can see that overall, I've got a moderate residual risk. What's driving that from the specific underlying risks that I've assessed, and even start to get information such as, where are the top risks in my environment? As I maybe start to scale this program, I want to drill in and focus on those. What is my overall approximate control effectiveness for the controls in place to mitigate this risk wherever it applies in our environment? There is a lot of power here for me as a risk or compliance manager to just surface the information and help understand where do I need to focus to ensure that my organization is best meeting its obligations. But when we think about these risk statements and how we apply them into our HIPAA risk assessment, really one of the key concepts we're going to have is our ability to set our risk appetite and our risk tolerance. And so as an organization, for whatever I'm using as my risk register, the ability to define these appetite and tolerance levels and have that automated in the system, as we'll see come through in the risk assessment, really helps me start to drive more efficiency and automation into the program. Because as I'm doing these risk assessments, I'll know in real time if I'm stepping outside of my organization's appetite or breaching our tolerance for these risks wherever we're assessing them. And we can use that to more efficiently drive action and just focus where we need to put our attention to get the biggest return on our investment, because we do have limited resources. We know we're all struggling with scale and scope. We'll come back to that risk appetite topic and what it looks like in practice. But the last thing I want to mention in terms of how do we set the stage with ServiceNow to go do our risk assessment is going to be this concept ServiceNow gives us of a entity type and our entities. Fundamentally, when we talk about ServiceNow or how we run any risk and compliance program, we need to define our scope. What are those things that we are going to go manage risk and compliance for? And then what are the risks and controls that apply to those things? ServiceNow answers this question through our entity types and our entities. Think of an entity type as a collection of risks and controls from our risk register and control framework that we need to manage for a given type of thing in our environment. So I've defined an entity type that's going to cover my EMR systems. And I'm saying here that these are the 22 risks and 22 controls that I expect to address with any EMR in my environment. And we know there may be multiple, but with acquisitions and M&A activities going on nonstop, we want to be consistent and scale. So these entity types help us to be consistent. Anywhere I have an EMR in my environment, which we'll model as an entity, I simply apply this entity type and they inherit our 22 risks and controls, effectively scoping what we need to go address within that EMR. And while we won't get into detail on it today, we can of course automate this through ServiceNow. If I'm tracking my EMRs in my configuration management database on ServiceNow, then let's go ahead and automatically generate this entity and assign these controls anytime we know there's an EMR in our CMDB. So maybe we bring a new one on board through acquisition activity. Let's make sure we don't miss a step and use this automation to close that loop. Now, with that, where we really want to go next is what does the actual risk assessment look like? So if I just drill into one of my entities here, we'll look at Acme Care, our hypothetical EMR today. There's a few key points we want to make. Again, I'm going to get summary on my compliance and my risk position based on assessments I've completed, perhaps in my last year. But more interestingly, I can see that universe of risks. We notice here I've got a few more than the 22 risks that we assigned through our entity type. And that's because we can put these entities into a hierarchy. And I think a common challenge we hear from our customers is there's so many things I need to assess. The interrelationships are complicated. I have an EMR that's used by multiple care facilities, maybe across multiple regions I'm managing, but not everybody uses the same EMR. How do we start to reflect and model the complexity of our environment? And then how do we create a true holistic risk picture reflecting those dependencies? And so through ServiceNow, we can take these entities and start arranging them into a hierarchy, create those relationships, and all of our risk and compliance information coming out of our assessments is going to start to roll up along this hierarchy. So if I just look at what's directly related upstream, I can see that my Acme Care EMR is used at the Century Medical Complex and St. Thomas's Hospital. Similarly, if I look at what's downstream, I know that my EMR in this instance is running out of my Eastern data center and my Midwest data center. So by creating all of these relationships, now when we go look at the risk or compliance profile for, say, St. Thomas's Hospital, information on the controls and risks we've assessed around Acme Care are going to be reflected in St. Thomas's overall risk profile. And if we take that a step further and look at everything that's upstream, we know that St. Thomas, in fact, is rolling up to our Acme Midwest region. So all of this information is filtering up, and it's giving me that ability to answer nuanced risk and compliance questions at an individual entity basis, be that my Acme Care EMR or St. Thomas's Hospital, but also at an enterprise or an organizational viewpoint, reflecting all of this underlying information. So I could even start to look at just within my Midwest region, if that's a business unit, how is all of this risk and compliance information rolling up to affect that slice of my organization? Okay, so with an understanding of our entities, our entity types, and our ability to put a structure in place, this really forms the foundation for us to go perform our risk assessment. And so the next piece I want to touch on is really how can we start to automate the scheduling of our risk assessment and really hold ourselves accountable and make sure we're looking at the right things. So through advanced risk, we have a built-in solution for our assessment scheduling. It's going to take us through just a couple easy steps. So what methodology am I going to use? I'm going to use my HIPAA risk assessment. What are the entities, the scope that I'm going to put into my HIPAA risk assessment? So here I've defined 5 entities representing my EMR, some data centers and facilities. But this is really where we perform that scoping exercise. Once we've defined what we're going to look at, we can very quickly say who needs to respond to risk assessments. If we're going to require approval on them, let's go ahead and reflect that to make sure we get the right sign off. And last but not least, let's set a consistent calendar-based frequency. I need to perform my risk assessment annually. So let's define this scope once and then kick that off on an annual basis and get automation working for us. And last, of course, I can set expectations for our teams in the field about how long we need or have to respond to these risk assessments and gather our data to make sure we're staying on our assessment schedule. With all that information defined, it's a simple matter for me to initiate all of my risk assessments across my in-scope assets, which we've already done in this instance. But then we'll also be able to get real-time feedback through this record of how is the risk assessment for this year shaping up. So I can see I've got a good amount of pending assessments in my Midwest region, but we've also got quite a few that have been completed or that are actively being responded to. All that information is here to help me manage the scoping of my annual risk assessment campaign. All right, so what we want to look at next is an example of an actual risk assessment. So as a user, all my risk assessments live in my workspace under my tasks, if I've been assigned one. And I have here a risk assessment we initiated for Acme Care EMR on that management approval of privilege assignment risk. We'll go ahead and pick up our risk assessment here. And we're going to see there's a lot of flexibility here. This can, of course, be configured to your organization's risk methodology. But we're going to use a simple common structure inherent, our control effectiveness, and then an output of a residual risk rating. So I give a simple series of questions to the user. In this case, what's the inherent impact of this risk? And I've got my statement of the risk right up top here to guide the user as far as what we're asking them. And if we have any related information, maybe we already know there's an issue related to this risk, or if we want to dig deeper into the details, all of this context is available to me immediately in the sidebar. And since we do this on a recurring basis, I can even see what were the results last year, or last time we completed an assessment of this risk. So all this context is here to help me get through this more efficiently and make sure I have the right information available to inform my responses. But we'll go through and complete it. Perhaps from an inherent risk perspective, if we're not having appropriate approval, we're going to say that could be a major impact. If we don't have any controls, folks are going to get too much access or the wrong access, and it's almost guaranteed that we're going to see some event resulting from that. You'll notice as I'm choosing these answers, my risk rating is updating in real time, and so too is my appetite status. So right now, I know I'm outside of my risk tolerance. But we've only done the inherent assessment. For our next step, we'll look at the control assessment. I mentioned that our risks and control frameworks can be linked, and sure enough, our risks and controls are directly linked. So I can add in here, what controls do we have in place to mitigate this risk? And maybe I want to add more. It's a simple click of a button to pull up my related list of controls and add them in and create these associations on the fly. But I can see here, we have a control. It's been determined to be non-compliant. And actually, if we again look at that contextual information, I can see I've got a high-risk issue and a failed control test on my compensating control here. So last year, when we completed this, we said this control was partially effective. But perhaps now we have a little more information. Maybe we still want to claim it's partially effective, or maybe we're going to even revise this and say, you know what, this isn't effective. We know there's issues with this control. If at any point we want to provide context on our decisions, we can add these comments in live and let everybody know, maybe that reviewer, why did we pick the answers that we picked? All right, so once our control assessment is complete, we'll move on to our residual risk. In this case, my residual risk is automatically calculated off my inherent and control effectiveness, so we can get a little more of that automation working for us. But we always have the option to subjectively override that risk score. Maybe I want to say this is actually just high, and I can give a justification for that, but I'm still breaching my risk tolerance. And so the system's going to mandate that I give a comment about why are we outside our risk tolerance. So we identified an issue, we know that exists, and we'll move on. Our last step here is an inbuilt capability to generate a risk response, our traditional mitigate, transfer, accept, avoid. So because I am outside of my tolerance here, we set a rule to say that a risk response must be put in place. We cannot allow you to leave this unresponded given that we have breached our tolerance. We'll choose that we're going to mitigate here. And with that, we'll go ahead and review and submit our risk assessment. Going to get that summary result, everything we just put in. Any comments we included throughout this are going to be presented. And now I can go ahead and submit this risk assessment, provide any comments to that approver if we're requiring that, and send it off. Now, in my example, I'm not requiring an approval, but we can, of course, have an approval workflow if you want that secondary assurance, QA, and oversight. It's very simple for us to put that into the workflow here. And with that, we've completed a risk assessment. We've identified that it's outside tolerance, and we know that there's going to be something that needs to be done about it. But the last piece of automation I wanted to show today is that based on that risk breaching our tolerance, or rather, I breached my tolerance in a previous risk assessment of that same risk, the system has been set up to automatically generate an issue. I know that my management approval of privilege assignment has a breach of risk tolerance. Therefore, let's put an issue in place and use the workflows ServiceNow IRM provides us to go and resolve that issue. We're not going to step through the whole issue and remediation workflow today, but this is really a key point as we think about how we're addressing our HIPAA compliance. We breached our risk tolerance, automatically generated an issue to show that we're aware of this problem, and now we're going to have this workflow in place to document what that issue is, that's its impact on our environment, and go put corrective actions or remediation tasks in place to show that we have a plan to respond to that failure and bring that risk tolerance back within our appetite. The last item I want to touch on today is going to be, of course, some examples of what we can do from a reporting perspective. And this is all out of the box with ServiceNow. So what I've opened up here is what we call our heat map workbench. And so right off the bat, I'm seeing here a heat map structured along my impact and likelihood scales with all of the risks that I've assessed across my environment through that exact same risk assessment we just looked at. And what's really powerful for me as a user here is my ability to filter and update this report on the fly. Maybe right now I'm looking at an inherent risk view, but I'm really more interested in my residual risk view. As I move it here, the system's going to call out things. So these flagged risks up here, that indicates to me that those risks are outside my tolerance and probably require some manner of attention. You'll notice our management approval of privilege assignment risk we just assessed is one such risk. Or we'll get this little warning sign indicating we have a risk that is outside of our appetite. We haven't breached tolerance yet, but we're outside our appetite. Let's put a yellow flag out there and go focus on this. But we could take this a step further. Maybe I just want to see my top 10 risks residually within the organization, a few clicks of a button, and there we go. That's my viewpoint. Maybe I want to see the top 20 risks. And last but not least, because we have this concept of entities, I can start to filter this report on the fly to see a risk profile of a given entity. So maybe I just want to know for the Acme Care EMR, what does this disposition look like? There's my top 20 risks residually across a heat map for my Acme Care EMR. With that, I'm going to wrap up the demo for today, and I'll hand it back to Drew to close us out with some Q&A. But I hope this has been educational for everybody and helped you to understand how you can use ServiceNow to both power your risk assessment process, as well as start to produce really powerful dynamic reporting. Go tell your HIPAA risk assessment story, both to your internal teams and potentially to your regulators. So Drew, over to yourself.
Sorry, I'm going to steal it from Drew real quick. Hunter, can you go back to your last tab on the issues? Can we just highlight how the issue is tied to the risk? There was a question about that.
Oh, absolutely. Apologies that I missed that.
No, you're not watching the chat while you're demoing.
ServiceNow gives us a great amount of, we can relate just about anything to anything. So we know this issue was automatically associated against our risk on that Acme Care EMR system. And this all happened without any manual intervention. We completed the risk assessment, the system generated the issue, and it linked everything up for us. So not just the risk that was impacted, but knowing it was on our Acme Care EMR and any other data that we may start to have over time if we create remediation tasks. All of that's going to be accessible to me through my lists across the top here to give us that context as we're working through.
Okay, great. Thank you. Now we'll pass it back to Drew for questions.
All right. Thanks, Hunter. Thanks, Barb. So I know that there was 2 questions that were still outstanding in the Q&A that we intentionally left for discussion at the end. So I know that we only have a couple of moments left, but one of the questions was, how would you compare and contrast the ServiceNow provided UCF versus the ARC content provided by Agile? So I don't know if Hunter, if you wouldn't mind taking that one.
Yeah, absolutely. Thanks for the question, Samina. So conceptually, UCF and ARC are similar. We are talking about integrated compliance frameworks that are harmonizing together multiple authority documents. So conceptually similar, but we would say where ARC differentiates a little bit is that it's addressing both integrated risk and compliance, whereas to my understanding, UCF tends to be focused more exclusively on the compliance aspect, control objectives in ServiceNow terminology. ARC is going to give you that integrated control framework and risk register so that we can really start to speak to both sides of the coin and how we are addressing the interrelationship between risk and compliance. The second point I would call out from a key difference standpoint is UCF tends to have a larger number of controls. I won't comment on what the exact number is. It varies. but we're typically talking about a significant volume. For most of our healthcare customers who use our ARC content, that ultimate control framework, let's call it, is going to be comprised of somewhere between 250 and 300 controls, as opposed to a potential order of magnitude more. Said differently, we think it helps scale a little bit better and keep the number of controls and risks you ultimately need to manage in your environment to something a little more sustainable for your teams.
All right, perfect. Thanks, Hunter. And one other thing to note, while the UCF content is available for download on the ServiceNow, it's not specifically provided by ServiceNow. So that was just one other thing to note. It's leveraged by the Unified Compliance Framework. So one other outstanding question coming from Cheryl: do best practice for assessments in IRM are to have multiple assessment types? We are trying to roll up NIST and HIPAA into one risk assessment for all of our business applications. It's not been very successful. So Barb, do you have any insight into that question?
Sure. I completely understand how teams can get stuck in that analysis paralysis. It can be overwhelming looking at NIST and HIPAA and trying to consolidate. That's where I think ARC can come in and help facilitate that. And what Hunter was just talking about, where the harmonization of those controls and risks down to a smaller, hopefully more manageable number, is what we have tried to accomplish, and where we are hopefully helping teams in that manner. Happy to talk about that in your use case one-on-one. I know everybody has unique challenges and why things maybe aren't successful, but the goal of ARC or any content pack, really, UCF as well, is to help harmonize NIST and HIPAA, and trying to go at it alone can be challenging. But in terms of answering the best practice piece of your question, I would say it's a worthwhile exercise, because audit and assessment fatigue is real. And so it's a meaningful and worthwhile exercise.
All right. Thanks, Barb. Appreciate it. So just to quickly wrap up, if any of you have additional questions or would like to spend more time talking with ServiceNow or Agile, we are certainly happy to extend those conversations. Please do not hesitate to reach out to Barb, Hunter, or myself. Additionally, we have provided links to connect with us by way of ServiceNow's website. And I believe that Teresa from our marketing team has also posted some of this to the chat. Our community, where our customers are having open dialogue and collaborating. ServiceNow's YouTube playlist, where we have posted a number of helpful on-demand videos. We also encourage you to participate in future events, and we have provided a link here where we keep our event calendar updated. With that, thank you so much, everyone, for your time today. I would also like to extend a very sincere thank you to Barb and Hunter at Agile for your collaboration and continued partnership in today's webinar. Again, please feel free to reach out to us to continue conversations, and we are looking forward to seeing you in upcoming events. Hope everyone has a great day.